Hello, everyone. Welcome to our May STEM Talks event. As you can tell from the slide and from our promotions, the event today is focused on nursing. So National Nursing Week is next week, so we decided to celebrate a little bit early and do a career panel focused on nurses. So how today's event will work, essentially, we have three individuals that work at the University Health Network. They will introduce themselves, what they do at UHN, and how they got to where they are. And then we will have an open Q&A period afterwards. Basically, if you have any questions, though, feel free to put them in the Q&A feature in the Zoom. So if you look at the bottom of the Zoom kind of panel, you'll see a Q&A button. Put your questions in there, and we'll try to get to as many as we can after all the speakers present on their work. As you can see again, I am recording the event, so you can watch this recording later if you miss any part of it. But again, that means please keep yourself muted and off camera so you're not going to be in the recording. For those of you that are here for the certificate program, as per usual, as long as you have logged on to Zoom and you attend most of the event, you are good to go. But don't forget, you also have to complete our exit poll at the very end. It'll just test your knowledge on the work that is being covered today. So it's not too bad. Just don't forget to fill it out. And additionally, if you haven't seen yet, we have launched the welcome poll. We're just trying to figure out who is in the audience today. So please fill that out before you start actively listening to the event today. So for the sake of time, I think we should start straight into the panel and hear from our speakers. So Carrie, you are up first. Whenever you are ready, feel free to take over screen share.
Thank you for having me here, everyone. Welcome. I'm Carrie. Tingling is my last name, and it is my real last name. I'm a nurse practitioner here at Toronto Western Hospital, and I work in the epilepsy clinic. It's part of the Crumble Brain Institute, so we focus on neurological disorders and specifically seizures. I'm going to talk to you a little bit about my role. It's sort of similar to the other panelists. In the past, I've also been in the role of the other panelists, but a little bit different. So you'll get to see the full variety of what you can do if you do go to nursing school and decide to branch off into different specialties. So a little bit about me. I am born and raised in Toronto. I was born downtown. Toronto is home. As I mentioned, I was a registered nurse, so that's RN. Before I became an NP, I worked as an RN for 5 years in the emergency department. And then I've been an NP for about 3.5 years now. Other than the medical stuff, my favorite hobby is anything music and arts related. So this is live performances and gigs, shows in bars or restaurants or in the park and that sort of thing downtown. I've done a little bit of a collage here of different gigs I've done throughout the years. Some are local, some are overseas. This was in Jamaica, maybe like 40 pounds ago. Miss those days. This is at a homeless shelter here. This was on U of T campus. So was this. This was in the Slurry District. So I still try to have fun in the midst of my studies. Another hobby is I enjoy renovating my 100-year-old house. It's been a labor of love, let's just say that. But now I'm making it my own and I still find it fun. Okay, so my education, I studied at the University of Toronto. I graduated 3 times. My first degree was human bio and psychology. I did a double major. And then I also did a minor in music history. The minor was mostly for fun, my own interests, so at university didn't feel as dense and intense doing a lot of the life sci courses. And it also helped to boost my GPA because music history wasn't that hard. In my undergrad, a picture here in front of the bread. That's me making sandwiches for the homeless population. I did a lot of volunteering. I did a lot of extracurriculars that helped to boost my resume and my CV. And it also helped me get to learn a little bit more about the community that I would serve. And then after I graduated, I went into research. I thought I was going to become a researcher. So I got a job at Sick Kids Hospital, but it only lasted a year because I absolutely hated it. It was very, very boring to me. It was very slow. It was very desk related. And just kind of like watching paint dry in a sense because there's a lot of red tape or things that need approval for research and it's very slow. I didn't get to talk to people. I'm very extroverted, so I did not feel fulfilled. But I met a research nurse in that position, and she told me about nursing school. And she said, if you still want to do a little bit of research in the future, but you still want to talk to people as well in your future, maybe consider going to nursing. So I enrolled in the accelerated nursing program at U of T. And then I was an RN for 5 years. This picture here on the right, where we're all wearing blue t-shirts that say nursing. Maybe some of you recognize who's in the middle. I don't know if you're old enough to recognize him, but that's Rob Ford, RIP, Doug Ford's brother. He used to be the mayor of the city. And on our first day of nursing school in our orientation, we got to meet him. We actually just went right into the city hall and asked for a picture, and it was fun. He's a little bit of a controversial figure, but a real Toronto legend for those who know his history. So that was fun. But then after being a bedside nurse for about 5 years, it was fulfilling. It was fast paced. I had a great time in Emerge. And I did love it, but what I didn't love was my feet and my back hurting me after 12-hour shifts. I also didn't like the weekend shifts or the holiday shifts or the night shifts. So I said, okay, how can I use my nursing knowledge, but to do something more Monday to Friday, 9 to 5? So I went back to school again, did the NP program, became a nurse practitioner. And this last picture here is me giving a talk at a school about my role a few months ago. Okay, so what do I do? I'm in an epilepsy clinic. That's where I'm at now at the end of the day, and I help to diagnose seizure disorder. There's multiple different kinds of seizures. A lot of people think they're just the ones where your eyes roll back and you're shaking and you're completely unconscious, but there are many, many other types. There's focal, there's generalized, there's pseudo seizures. And I also, in my role, I order tests to try to help determine what seizure somebody has. So here is an MRI. It's essentially a scan of your brain, and we look for anything that looks a little off or funky or different that might indicate why somebody has a seizure. So this arrow is pointing to this sort of whitish area where there's a tumor. A cause of seizures are tumors, strokes, malformations. There's genetic causes. There's traumatic injury. So if you get into a car accident, you can have a seizure. Infections, substance use like drugs can cause seizures, metabolic abnormalities. So that means if your blood sugar is really, really low or your sodium is really, really low, there's also some unknown causes as well. And another test I order is EEG. So we put really cool electrodes on your brain. Sorry, on your brain. We put a couple dozen of them, and we look at your brain wave and we see what it's doing, and we try to determine if it looks seizure-like. I also work with specialty populations. This includes pregnant women who have epilepsy, people who have a really bad drug addiction, and rare genetic syndromes. So just bringing back the music theme and the research theme, because though I love working with people and talking to people every day, which is great, I still found a way to incorporate my passion for music into my day-to-days in the form of research projects. So this is a study that I'm almost ending, just coming to the end of. It's called the Lullaby Study. One of our neurologists here, Dr. Esther Bowie, as well as the Roy Thompson Hall and Massey Hall, which are concert halls downtown, we all collaborated and found a way to help pregnant women with epilepsy create a custom lullaby for their baby. So there's 21 songs here, but I think we're closer to 30 now. And they got a chance to hop on the song. They could play instruments like this patient. She's very talented. She's playing the violin. But if they were shy, we got singers and songwriters and instrumentalists from Roy Thompson Hall and Massey Hall to create the song. And then we just looked to see how that impacted their mental health in the course of their pregnancy and the postpartum period. So that's one of my fun projects. My other project is researching cannabis and its impact with epilepsy. It's still a bit of a gray area. Some research does say that cannabis can help with seizures. Some say that it can make it more active. So I'm part of a national trial, the first of its sort. We got a huge grant from the government to just research this in more detail. So what does a week in my life look like? I set my own schedule. This is how I've organized it. So on Mondays, my research day, I recruit patients or participants for studies. I give talks like this as well. I continue to learn myself because science in the medical field is always evolving and you have to stay on track with the new research. So Monday is my research day, my academic day. Tuesday to Thursday, I see patients from 9 to 5. They're scheduled every 20 to 60 minutes or so. These are new patients that are referred. These are follow-ups. I also attend a surgical case conference. So these are those that tried a lot of seizure meds and they didn't work for the seizures. And now we're considering epilepsy surgery. We have a conference with a team of neurosurgeons and neurologists to decide if they're a candidate. And I also run support groups as well. during the week. And then Friday, which is tomorrow. No, tomorrow's not Friday. Tomorrow's Thursday. Anyways, Friday, the end of the week, is my office day. So that's when I review all my test results, remember those MRIs and EEGs that I order, give my patients a call, let them know what the test showed, do a lot of charting, do a lot of documentation, and then I enjoy my weekends not at work. Okay, so why did I choose to become an NP? There's a lot of self-discovery. As I mentioned, I thought I was going to go into research, hated it, decided it wasn't for me. Was wondering what I was going to do with this life sci degree now. Everyone thinks about medical school, but when you look into it, it's at least $250,000 in student loans that may take decades to pay off. So I said, that's not also for me. And there's also a permanent commitment to one focus or specialty. If you go through the medical route, they have something called residency, where for anywhere from 2 to 6 years, you have to focus on just one specialty, and you're sort of locked in for life and you can't pivot. Whereas, as you'll probably hear today, the other nurses and the panelists, as well as myself, when you get bored after a couple of years, you can shift focus. So you can do the bedside, you can do the research, you can go back to school, you can work in a school with kids. There's lots of variety in nursing, which was attractive to me. As you know, I hated weekends, nights, holidays. And even though I still have a soft spot for bedside nursing, my back and my feet do not. So that's fine. And in general, NPs are helpful because, as you know, some of you probably are experiencing, it's really, really hard to find a family doctor nowadays. It's a huge shortage. But fortunately, nurse practitioners in that extra 2 year master program that I did after becoming an RN, I was able to learn how to diagnose and prescribe in the same way that doctors do. So we sort of bridge that gap and help to reduce the shortage overall. And we spend more time with our patients because we don't bill the government for each consult. We get a salary pay, so we spend as much time or as little time as we want to. So my final career tip is, just like I did with music, and a little bit of research, find ways to incorporate your passion into your career so it feels less like work and more like fun. Okay, I'll stop sharing. Oh, it's me. Okay.
Perfect. Thanks, Carrie. Mark, you are up next.
Good evening, everyone. I am truly honored to speak with you today. My name is Mark Anthony Graboso. They call me Mark Graboso, registered nurse at Toronto General Hospital, and I am an internationally educated nurse, or IEN, an advocate to my fellow IENs, and a nurse leader. I am the current president of the Phil Canadian Nurses Association, so you can see some of my postings in LinkedIn and other social media, promoting the mentorship of international educated nurses. And to give you a bit of my background, so obviously I'm from the Philippines. I was born and raised there. Like many of you, I was once sat in the classroom filled with dreams, questions, and deep curiosity about the world. I never imagined that one day my path would take me across continents, from the busy streets of Manila in the Philippines to the healthcare system of Abu Dhabi, United Arab Emirates, and now here in Toronto, Canada, where I serve as registered nurse at Toronto General Hospital. I am what you call an internationally educated nurse. So I have foreign credentials, trained in the Philippines and United Arab Emirates. And my journey has been guided by strong passion for science and a deep desire to help others. So nursing is not just about giving medicines, checking vitals. It's about using science, critical thinking, and compassion to care for people in their most vulnerable moments. So I would say that this STEM talk would really help, help the young, the youth especially, because it is not just found in laboratories, the STEM or the science, technology, engineering, and math. It's not just found in laboratories or computers. It is alive in the hospital rooms, research centers, community clinics, and yes, even in the work that nurses do every single day. Whether it's learning how the human body works, using the cutting edge technology to monitor patients, or making fast evidence based decision making, nursing is a living and a breathing example of the STEM in action. So, STEM is not only about knowledge, it's also about purpose. So about my hobbies, like being a nurse, when work gets exhausting and emotionally heavy, I recharge by going on a road trips with my family. So you can see the picture there. So last time we went to Muskoka and and find peace in nature and strength in the quiet moments. So these moments or break from doing the bedside care reminds me of the importance of mental health and wellness of being a nurse. And I also love giving back. So by mentoring fellow, you can see this one, the mentorship. I am leading the organization for the international educated nurses and also volunteering in the community where I found purpose in giving back. So to all of you here today, you have the power to shape your future through this STEM talk. Whether you want to become a nurse, an engineer, scientist, or a tech innovator, your journey starts now because with your curiosity, your questions, and your courage, actually, you don't have to be perfect or like getting the exact job or professions. You just need to be brave enough to try, learn, and grow. And who knows, one day you might be the one speaking here, inspiring the next generation. So keep dreaming big. And when it comes to my education, so I got my Bachelor of Science in Nursing in the Philippines, where I graduated in 2007 with this degree. And right after the graduation, I started working as a registered nurse in a medical surgical unit um, at Manila Doctors Hospital. So I was a scholar there. So this being a scholar like aided my financial difficulties back then. And then I spent 3 incredible years learning, growing, and discovering how science and empathy come together in nursing. Um, During that college or university days, I used to be a leader, so that's why I was like thinking on how to continue my leadership into how to take care of other people. So that's why I found nursing to be a noble profession that I can continue until the end of my life. And yeah, but my journey did not stop there. I wanted to expand my knowledge and to take on new challenges. So I moved to Abu Dhabi, United Arab Emirates, where I spent 7 more years as a clinical nurse. There, I saw the technology, global standards, and teamwork could change patient outcomes, and it deepened my love for this profession. And in 2017, came to Canada, determined to continue my career. And the struggles is real, and being an internationally educated nurses. So I completed the competency assessment that you can see on my screen, the Touchstone Institute, where I get the Registered Nurse of Canada Competency Assessment Program, where I get my registration here in Canada. But with that kind of experience, it was one of the most challenging, yet rewarding, I would say, experience being here in Canada because it reminded me that learning never stops. And but part of my journey that I'm most passionate about today is like the mentorship. Because of my experience, I wanted to give back. I wanted to know like those who are struggling, especially in the nursing registration here in Ontario, and integration, workplace integration. So I wanted to help other nurses, my fellow INs, and even like a student when I do preceptorship on the floor, to find their way, just like others, like help me when I was started here. That's why I pursued the clinical educator certificate at the Missionary Institute of Education at UHN, so I could be better equipped to teach, guide, and empower others. So that's why for all those like grade 7 to grade 12 here, so this is like the beginning, that dreaming, exploring, and discovering. I want you for you to have this path through the STEM initiatives. Whether you want to be a nurse, a doctor, a researchers, an engineer or innovator, your curiosity is the key. So don't be afraid of hard work. Let your passion fuel your progress. So let your challenges build your character and let your dreams shape your direction. So my work on 13 Eton General Internal Medicine, 13 medicine unit is a very fast-paced unit. So this is like the unit where we provide care to geriatric and adult with acute and complex medical needs. So every day brings new challenges, new learning, and new opportunities to make a difference. So one of the greatest strength of 13 Eton is the variety of nursing procedures and skills you will encounter. Not only giving the medications, advanced care planning, critical thinking, um, and collaboration with interdisciplinary team. So that's the one best, would say, experience that you can get from the general internal medicine. And one more that I'm very particular about is the mentorship. So I want to enhance the bedside skills of those internationally educated nurses. So that's why I'm leading the organization for others. This is like the part of being a bedside nurse and, integrating of being like a leader in the community and being an IEN advocate. So I want like this mentorship to help bridge the gaps by providing the guidance in real world context to IENs and building confidence and competence because I know how it feels when I was like starting here in Canada and the cultural and communication adaptation and eventually to build a career development and networking. So that's why I love mentorship. And some of the clinical enhancement and mentorship for IENs. So I'm very particular. So what I've learned from general internal medicine, I usually share to the IEN community to support them in transitioning into Canadian healthcare workforce, inspire others, and boost their confidence. As I said, learn from their experience. So I created a group of mentors so to help them to assist those newcomers and other IEMs to have a knowledge about the Canadian healthcare settings. So yeah, that's the thing. So how the mentorship relates to what you to do every day. So I think mentorship relates to what you to do every day because it mirrors how they learn, they grow, and connect with others. Whether it's asking a questions in class, getting advice from a coach, or helping a friend or learning a new skill from someone more experienced. So every day, youth are engaging in informal mentorship through seeking guidance from your teachers, your older peers, sharing knowledge with your classmates and your younger siblings, learning from mistakes and improving with feedback, and being inspired by role models like this. What we are doing here at the STEM Talks. So mentorship is simply a more focused and intention version of those everyday moments. So it's about building relationships that empower growth, encourage confidence, and help young people to see their full potentials. And yeah, so this is like the what like I'm working aside from being a bedside nurse and being a community leader for the IN community. So the week in the life of being a bedside nurse. We care for adult and geriatric patients with acute and complex medical needs on 13, which the day and night shift. So basically, a typical day shift to make starts early at 7:15 a.m. And with the transfer of accountability, we do the bedside reporting. And so this is just like not a routine handover. It's a sacred moment where, like the teams working together to ensure that we deliver an extraordinary patient care and in detailed making sure that we're not missing any critical information for our patients. And at 8:15 we do safety huddles and we actually discuss about the quality, delivery, and efficiency in the morning. And then also we usually do night shift and yeah, from nighttime, so we do also the bedside reporting. And aside from being a bedside nurse, I'm also leading an organization. So I'm the current president. And aside from that, I'm also a clinical instructor for IV therapy workshop. So I share the best practices in IVs with IENs. I'm working with other organization, giving like the best practices that we use on the floor. And yeah, so the importance of my job and why I choose nursing, it's in line with the National Nursing Week theme. So we have the power or the power of nurses to transform health. So I believe it's about making a difference in people's life. It's a career where I could truly make an impact every single day, and I wanted to be someone who could offer comfort of healing support not only with skills but with compassion and of course with a heart. And I would say maybe I chose nursing because I wanted a career that truly make a difference every day. And I remember when I was in high school, I used to serve as a student leader, and even and back then I knew I wanted the future where I could continue to lead, serve, and make a difference. That's why I chose nursing. And I think that's it. So I think my key takeaway or my advice, I encourage the youth to be curious, explore, and take advantage of every opportunity to learn, whether it's like joining a science club, participating in this STEM talk, and or simply asking how, why, or how. When you see a challenge in healthcare, you're taking a step toward becoming a leader in this field. So, and that's it. Thank you.
Fantastic. Thanks, Mark. We'd love to hear your passion for mentorship, and it's very important to us and hopefully the students as well. All right, Evan, you are the last one to present, so whenever you're ready, take over screen share.
All right, so my name is Evan Varnicki, and I'm a registered nurse, and I work in the operating room at Toronto Western Hospital. Okay, next slide. So background about me. So I was born and raised in Toronto. I lived in Toronto my whole life. And I'll go through some of my hobbies. So let's go through some of these pictures. So I really like being active and I like being outdoors. So my first picture here is me. I'm on the inner tube water polo team on the U of T team in nursing school. So that was really fun. Team did really well. Then below that, I have a picture of my two dogs, Jasper and Sully. I like to come home to every day. Then this next picture is I'm out canoeing with my friend Nick, and this is actually a good opportunity I got from nursing school. So we were working at a summer camp, and we were working as camp nurses, and this was one of our day offs. So we took one of the camp canoes and we went out and did some fishing. And then to the right of that is I'm mountain climbing in Slovenia, and there's a bunch of goats way up there, so I thought it was funny. So, sorry, can we go back 1 second? So I started working in the OR in September of this year, so I was hoping to give a bit of a new grad perspective on nursing as someone who's just finished nursing school. Next slide. So I didn't start in nursing school right after high school. First, I went to Waterloo, and there I was studying molecular genetics. And I had co-op there, which I got to see kind of the research side of biology, and I got to be in medicine as well. And seeing at UHN, I was seeing research in arthritis as well as brain cancer, and it was really cool, and I liked it a lot and really liked all the medicine side of things. But I was kind of not liking the research part of things as much and found it kind of more boring. I didn't realize how much desk stuff I had to do, and I wanted something where I was moving around more and doing a lot more stuff with my hands. And so I was looking at different careers and trying to figure out what to do, and I was like, oh man, I wish I did nursing after high school. I wish I knew that was an option for me. And I was looking to see if I could transfer, and then I saw that there was accelerated programs for people like me who, you know, have a few years of undergrad under their belt, or maybe have even finished an undergrad degree. So I applied to U of T, and I went there and I really loved it. After my first week of clinicals, I was like, yeah, this is perfect. This is exactly what I wanted to do. Awesome. And then when I finished school, I started working in the OR. Next slide. So OR nursing. So when you're even in nursing school, it's hard to even know what OR nursing is. It's hard to know until you're in the OR actually doing it. So here I have a picture. This is OR 15. It's the hands OR. So you can see in the background there's a picture of hand anatomy to, I guess, if the surgeons need a reminder. So the services I'm usually in is orthopedics, and I'm starting to learn some spine as well. But we have a lot of different services at Toronto Western. We have hand and plastics, general surgery, neurosurgery, orthopedics, ophthalmology, robotic surgery, spine surgery, neurology. And as a nurse, one of the big things I like about nursing, instead of going the medical route and being like a surgeon, is we get to do all of these. So one day I could be in neurosurgery and getting to see the brain, and the next day I'm in spine surgery, helping out with like stabilizing the spinal cord, and then the next day I'm doing knees and hip replacements. So I really like that versatility and getting to learn and see lots of different procedures. So within the OR, as a nurse, there's kind of two roles, and at Toronto Western, each nurse is trained on both those roles. So you don't only do one or the other. So you're either scrubbing or circulating. So if you're scrubbing, that's like the nurse who's sterile. So they are the one who goes and does the scrub in the sink, like you see on Grey's Anatomy, and they put on the gown, and they'll help gown and glove the surgeons as well. And the scrub nurse also, they're the one, they assemble all of the equipment, they set up all the sterile field, they might help with draping the patient and prepping the patient. They also handle all the medications used for surgery, so any pain medications they might need that's local, the nurse would be the one handling those and giving those up when they're needed. And they really just facilitate everything flowing smoothly, having everything ready. And the circulator nurse, so that they're unsterile, so they're able to go and get supplies that are needed. They also help assist anesthesia and intubation at the start of the procedure. And before the patient's even in the room, that's the nurse. They're going to do like a pre-op assessment. So see what the baseline of the patient and compare that to after surgery. Make sure we didn't do any damage to them while they're in the OR. Another important thing they do is they organize the patient flow. So they'll make sure we have a bed afterwards that they're going to, and they really just oversee the whole OR. So it's really important to have the nurse in there because we have the surgeon, they're focused on the surgery. We have anesthesia, they're focused on keeping the patient asleep. So the circulator's nurse is really to be the patient's advocate in the OR. Everyone else is worried about what they're doing, but we're remembering the patient under those drapes. They're not just the surgical site that the surgeon's working on. We're looking at them holistically, making sure, they're not going to get any damage to their skin by the way they're sleeping, or that their leg didn't fall off their table, or anything like that. We're really making sure that we're respecting their dignity and doing what they would want in the OR. Next slide. So a great thing about Toronto Western and UHN for nursing is there's a program called the Krembo Research Program. And this is funding exclusive to nurses for research projects. So a project I'm going to be working on is nursing career outreach, where I'm going to try and provide an understanding of nursing as a career to high school students, because that's something I feel I didn't really have as a high school student. I didn't see nursing as an option for myself, just because I didn't really understand what nurses do. And I really want to make sure that high school students now get to see what nursing is. And how do you know you want to be a nurse unless you know what nurses do and you know it's an option for you? So here we have some pictures of some of the nurses learning some spine surgery and actually getting to do some of the surgery on some dummies, I guess. So, and we have a tray as well. This is some of the spine equipment we would use to put in, for example, screws and to drill holes that we would need to put those screws in. So I would just think it's cool to show you guys kind of some of the things we do in the OR as nurses and some of the learning opportunities we get. Next slide. So a week in the life. So a really good thing about the OR is we have a really predictable schedule. So it's usually 7:30 to 3:30 Monday to Friday, right? Where a lot of the surgeries are planned, and so they can have predictable staffing. You will usually once per week have what's called a J shift, and this is where you start a little bit later. You start at 9:30 and you end at 5:30, just for any rooms that are running late, and also to do breaks. So it's another thing that's great about OR nursing is you're always going to get your breaks on time. But there's also emergencies and unplanned procedures, so we can't just have nobody in the OR on evenings and nights. So you'll also have to sometimes work evening shifts, which are 3:30 to 11:30 at night, and then there are some night shifts, which would be 11:30 to 7:30, and you also have on call where they might call you back because they need more nurses because there's more emergency cases than they expected. And Fridays are always an exciting day. We have in-services on Fridays sometimes. So the whole OR starts later. It doesn't start till 9 o'clock instead of 8 o'clock. And so we get that extra hour back to have nursing learning time. So I have this picture on the right is of the robots, which just got implemented. I think the first surgery at Toronto Western with this robot was on April 8th. And so we had an in-service and we got to learn how to set up all the robot and all the things we would have to do. And this smaller picture on the left is actually the surgeon console. So they let us try out the robot and it was really cool. Like you could feel it and you had these goggles on and you could like speak to the other people in the consoles, and it was very cool to get to try that as a nurse. And then here, this picture of the tray is sometimes for in-services we'll learn systems that we already have, but there's lots of new staff, so sometimes we'll get opportunities to handle all the instruments, do any assemblies that we need to do, like learn how to assemble the instruments and how to use those instruments. And then these in-services they also use for feedback from nurses. So we're the ones using all the instruments and using the trays and organizing the OR, so they like to get our feedback for how to make things more streamlined. So they might ask us like, hey, what are instruments you guys never use in these trays that we could take out so they don't have to be cleaned and processed, and they could just make the trays lighter and one less thing to look through when you're trying to find your instruments. So those are another things that might happen on Friday in service. And just last week we had a nursing conference, which was very exciting, and we got to see different nursing presentations, and it was a good opportunity for nursing. Next slide. So why did I choose nursing? So nursing I really like because it's a fast-paced and dynamic. You get to do lots of different things. Like every day is a different day. I get to be in a different environment, and I get to see different surgeries every day. Whereas in medicine, you might only be doing the same surgeries, like you're only doing knee replacements. Whereas as a nurse, I might get to do knee replacements one day, but then I might get to do spine surgery the next day. So I get to see different things all the time. And it's a really good team environment. You have to be a really good communicator in the OR. You have to explain what you see, what you're worried about, and you need to be able to speak up, which takes a lot in the OR, especially when there's surgeons and people who you might feel like you don't have the ability to talk up to, but you do as a nurse, and it's very important to do that. Another thing I really like about the OR is the immediate difference you make in patients' lives. Sometimes patients come to the OR, they're super nervous, understandably, about getting the surgery, and as a nurse, you're the familiar face, you're the one that saw them right before surgery, and then you see them in the OR again, and you're able to be that familiar face that helps ground that person and really talk them through what's going to happen, help them know what's going to expect, and make them feel safe. And lastly, one of my favorite things about nursing is opportunities for career growth. There's lots of further education you can do in nursing. There's lots of lateral movement you can do in nursing. If I get bored of the OR, I could always try a different area of nursing as well. And I love all the opportunities that nursing's giving me, and I'm having a great time as a nurse so far.
All right, thanks, Evan. I'm gonna stop screen share and bring all the panelists back on screen. So thank you for talking about your careers. We had a lot of questions come in. I think some of them have been slowly answered, but a lot of them have not. So I'm just gonna try to get through as many as I can over the next 20 minutes or so. So I guess I'll start kind of at the general question. A lot of students were asking, so you chose nursing, did you ever consider alternative career paths? So some of them are thinking they might want to become doctors, or is some that wanted to be involved in therapy. How did you decide that nursing was a specific healthcare path you wanted to go into instead of a different pathway? And maybe we can go in order of speakers. So Carrie, let us know how you chose nursing specifically.
Yeah, so I mean, there's lots of other medical specialties that can be fulfilling for you. Therapy is great. There's occupational therapy, physical therapy, speech language pathology, pharmacy, dentistry. There's so many other options. Ultimately, for me, to be honest, I just looked at the job market and I realized that nurses really, they're hugely in demand. You can literally work anywhere in the world. And you have a lot of transferable skills. So a lot of the skills that you learn in nursing schools, you can then take to other specialties, but sometimes this doesn't really work the other way around. And as you heard, I didn't want to be locked in. Evan talked on about this as well. There's just so much variety that you can try out when you're bored after 3 years, 4 years, you can pivot again to another specialty. And that's my answer.
Fantastic. Mark, what about you?
For me, like I always wanted to become a doctor. So since before, like I know, like financial difficulties, but since when during my high school days, I used to be yeah, I served as a student leader engage in community engagement, activities, volunteerism. And at that time, like life is like a lot of difficulties, especially financial. So I was able to meet person who like grant a scholarship for me to send to college and finish my Bachelor of Science in Nursing. So I was very fortunate, like at least because in this profession I know like the leadership meets compassion, like ever since I wanted to care about people. So at this time, I can continue become a leader, and then at the same time, providing care and extraordinary care for patients. So that's why I ended up here. Yeah, that's it.
Great. Evan, what about you?
So a big part for me was I also thought I wanted to be a doctor, right? When I was at Waterloo, I was like, it seemed like the natural progression, but it was also just because I wasn't really aware of other medical professions out there, like nursing. And I think a moment it really hit me was I was working in a lab for one of my co-ops. It was a neuro-oncology lab, so it was for brain cancer. And I was just talking with one of the neurosurgical residents who I still work with, but in the OR now. And he was just telling me about like how many hours he works and how long it's going to be until he's done residency. Like I think his residency is 8 years, and then he has to do a fellowship. So he's like, I'm not going to be working on my own until I'm like almost 40. Like, and I was like, oh wow, like I don't think I want to be 40 before I'm like done everything. Like I want to start working now. And so now I'm working, and I just finished school in June, and I'm having lots of fun in the OR.
Fantastic. So you don't have to be a doctor, you could be a nurse. This is great. All right, a lot of questions about getting into nursing programs. Is it difficult? Are there like written tests that they have to take? So just want to generally know what that process is like. Does anyone want to answer like a general? Maybe Evan, you most recently did all of that. Let us know.
Yeah, I can talk about that. So my program is a little bit different because it was accelerated. So you can't apply to my program at U of T, and I think a lot of universities have this accelerated program. You can't apply right out of high school. You have to go and do at least 2 years at a university. So I actually did 3 years at Waterloo, and then I applied. So I didn't finish at Waterloo. But I think a big thing that helped me was my co-ops. So each of my co-ops, I kind of got a little bit of research experience, and universities really like that, especially U of T's accelerated program. They really like that, extracurriculars and those research opportunities.
Can I add something?
Go ahead.
Yeah, nursing school is actually really hard to get into. I'll be completely honest. There's a limited amount of spaces, and usually the people that get in have a variety of like their resumes are stacked, so your grades have to be pretty good. You also need to have certain science courses under your belt, and then you also need to be able to show that you've done a variety of extracurriculars. The program that Evan did, I did as well. And in our accelerated nursing program, because we didn't go in from high school, a lot of the students are mature students. They already have a few years of undergrad. To actually get in from undergrad is probably the hardest. So kudos to you, Evan. That's really, really difficult. When I did the program, a lot of my colleagues were chiropractors in other countries. They were dentists, they were pharmacists. They had 1 or 2 master's degrees already, and then they got in. So yeah, it's definitely a lot of work. But yeah.
Hope there is hope. Okay, more questions, I guess, on the nursing pathway. The students are asking, are there any extracurriculars that they should do now if they do want to go to nursing school, or in general, is there something that they should be considering while they're in high school or they're about to start undergrad? What should they do in their free time outside of school? Mark, what should they do in their free time?
Yeah, as I said, like engage yourself to any community activities, because you will know like if really nursing is for you. Because when you care for others and at the same time mentoring others, getting knowledge, getting like listening to the others' experience, I think you will incorporate and integrate everything, and then you ended up like oh, I love nursing. And yeah, I think better to do some volunteer activities, volunteerism, and yeah, I think that would be the best advice for the youth to engage themselves during their free time.
Fantastic. Evan, anything to add? Anything that you did that they should do?
I think something that helps is just shadowing, seeing if that's something you actually want to do. Like the best way to see if nursing is something you want to do is to see what a nurse actually does firsthand. Because it's easy to explain it, but unless you're seeing it, it's hard to know if that's something you want to do. And that shadowing also shows that you had some interest and some drive towards wanting to do that.
Carrie, they want to know more details about the exact difference between a registered nurse versus a nurse practitioner.
So all nurse practitioners start off as nurses. There are no NPs without RNs. Um, there is no hospital without RNs. RNs, and I guess practical nurses as well, are the foundation of healthcare. So I guess the best way that you can put it is, I'm not a doctor, but if you consider what a doctor does, you go into a merge, you have a really bad headache, somebody needs to figure out why you have the headache. So the doctor or the nurse practitioner diagnoses the cause for your illness and does a workup. So does a bunch of tests and tries to read them and solve what's going on. And once they figure out what's going on, they then think of a treatment that needs to be enacted. But that's usually where their role ends. They sort of figure things out. Then you actually need to be treated. So the nurses have hands-on skills that get better over the years. It's a very particular skill set to have to be an RN, where you could then enact the actual treatment. So, most doctors can't put it in IV, but most nurses can. And it doesn't matter if we know that the cause for your headache is that you have a infection in your brain, how are you going to get the medication there? So this is where nurses come in. So they do more of the hands-on treatment. There's also extended spectrum and scopes for nurses as well, especially rural out in northern Ontario or in certain areas where even RNs practice in a sense like nurse practitioners or doctors as well. So, and you always have to have the critical thinking aspect going as an RN. To be honest, I feel like a lot of registered nurses are already kind of working as nurse practitioners in a role, but they not legally, but so that's the difference. So diagnosing and prescribing versus actually treating people hands-on.
That's straightforward. All right, Mark, question for you. What is the hardest part about being a bedside nurse?
The hardship, actually one of the challenges is like, the 12 hours, like long standing, especially during the COVID time, like donning, doffing of the PPEs, personal protective equipment. That's one of the challenges during the COVID. And, you have to hold your emotions, especially during when someone is like, passing, and then you have to like after providing the postmortem again, that's the only time you can like observe everything, because right after postmortem again there's another admission, so you cannot have the time, a moment for you like to observe everything. So being a bedside nurse is just like fast paced, like you have to be like fast act, because what admission is coming. So that's, I think, one of the challenges of being a bedside nurse, like you cannot like observe everything, and then I think at end of their shift, that's the only thing, like he cannot think and everything and do self-reflection. What happened during that day, and then yeah, do self-reflection.
That sounds fun though. All right, Evan, question for you. Do you prefer being a scrubber or a circulator? What is your preferred role in the OR?
I like scrubbing. It's really fun and it's really satisfying when you're like, you know all the steps and you really know what's next. Or sometimes like a really fun experience I had was we were removing someone's gallbladder, and normally it's the resident, they're doing it laparoscopically. It means that there's little holes in the stomach and they have like a camera in and they have all the tools in through these little holes. And there was an emergency, so the resident had to go, and the surgeon needed someone to hold the camera. So I was now getting to hold the camera and point it where they needed it. And so sometimes you get to be like really, really involved as a scrub nurse, and it's really fun.
Right. We have students, I guess, generally asking about work-life balance. Do you have a work-life balance? Do you have a life? Hopefully. So maybe we can all just briefly talk about how you balance your schedule. How complicated is it every day? Like they saw your week in the life, but like, is there other things happening in your life outside the work hours? So Carrie, what about you? Other things happening?
I'm boring. I renovate my dusty, decrepit house. Go to the gym. You can't tell, but I do. And I do music stuff. I host a spoken word open mic nights on Tuesdays. Um, More of a life now than I did when I was bedside, but I'm also older than the other panelists, so I can't hang the same way.
Okay, but that's good though. You do some renovations and things, we'll take it. Mark, what about you?
Yeah, for me, like being a bedside nurse. So when work gets exhausting and becomes challenging, time to pause, reset, and then like stay away from the the thing or the bedside. Yeah, and go for like a road trip or anything. So like what I did last week. So I'm not checking my emails. I'm not checking, just like you have a peace of mind. Like stay away from anything like stressors and enjoy the moment with your family, and they try to connect with the nature, and then you will be reminded of how important the mental health and wellness of being a nurse. And then go back. And then this is like life. Like you care for patient and they become challenge and you struggles. But at the end of the day, you have to take care of yourself because who will take care of your patient if you're not taking care of yourself, right?
Okay, good. That's two for two-ish. All right.
Yes.
What about you?
Uh, I'd say it's a good work-life balance, especially in the OR. You usually get your weekends off, and finishing at 3:30 is great. Usually home by 4 if you live close to the hospital, so you got your nights to yourself. You do have to go to bed early, so you have to usually get to the hospital around 7, but that's true of most hospital jobs. So I'd say I have a good work-life balance. I'm on a Sunday soccer league, so still get to do some extra things and have fun.
Very good. That's three for three. So basically, become a nurse. You will have a work-life balance, is what we've learned today. All right, we don't have time for many questions, so I'll do kind of a few rapid-fire ones. So, Evan, I think maybe you can answer this one. They're asking about the NCLEX, how you write it, what it involves.
It's the test that you have to write to become licensed as a nurse. So, in order to write this test, first you have to get your nursing education from a approved university. So that's your Bachelor of Science in Nursing. And once you have that, then you are able to register with the College of Nursing, and then you can write your NCLEX. So it's a long test, and it encompasses everything in nursing from labor and delivery to pediatrics to surgical. Like, it's everything's on there, and all the medications you need to know. So it's lots of studying, but it's nursing school. Most of what nursing school prepares you for is the NCLEX, and you have your clinicals to learn lots of the other stuff. But the actual class you're taking, I feel like they're very related to NCLEX. Your exams you take in nursing school, the questions are similar to the NCLEX, and then afterwards, I studied for probably about 3 weeks to a month to write my NCLEX, and I used a program. I'm not affiliated with them, but I used UWorld, and I found it very helpful, and the questions were very similar to the NCLEX. So there's lots of different ways to study for the NCLEX.
That seems like a very short period of study time, but great job. All right. In terms of studying in school, Carrie, students are asking, what was the U of T experience like? Did you like U of T? Is it a good place to go?
Yeah, I'm biased because I went there 3 times. U of T gets hate sometimes because not everybody likes it. It's not for everyone. It's for people who are self-driven, for people who enjoy learning, enjoy critical thinking, and also enjoy, I would say, like the foundational aspect of science. I had a great time there because it was downtown. Back when I went in the 2010s, downtown life was a little bit more robust and definitely cheaper. We get like $3 drinks all over campus. Now I know the new generation, it's much more expensive. So your sort of entertainment life may be a little bit different, but it's still nice being downtown. It's a very accessible university. Your classes is a beautiful campus. Your classes are spread out and there's lots of extracurriculars you could do as well. So I'm biased. I loved it. Some people say that the classes are too big. I had a class with 2,000 people in my undergrad and convocation hall. It could be a little bit intimidating. But yeah, no, I liked it.
And Mark got a question for you too. Any tips for like an international nurse writing their licensing exam? So coming over to the license exam in Ontario, tips or tricks, Mark?
Yeah, for me, I for those international educators with foreign credentials and experience, I think better to search than ask, gather all the information for coming to Canada, and then like accurate information from those resources, I think it would help. And then plus the community support. Like community support means like a group of nursing organization, nursing groups that would help you to navigate the complexity of nursing registration here in Canada, and then at the same time, how you can effectively integrate into the healthcare system. So I think it helps a lot when you know someone or a group that will really support you during your nursing journey.
All right, so I think we have time for one more question, but Trisha, why don't you watch the exit poll so students can start doing the exit poll while we do the wrap up? So the exit poll is just asking you if you learned something, and then we'll ask you a little bit about the panelists, so what an acronym is, etc. So please fill that out while we do one final question. And the final question is, do you have just a short little piece of advice for these students who are potentially pursuing nursing in the future? Is there one thing that they should think about, or should they even not worry about it yet? What should you advise them, or what you want to tell them? Carrie, you can go first. What's your piece of advice?
Do it because there's a lot of jobs and there's a huge shortage, and you will be able to have a fruitful lifestyle.
Mark, what about you? Piece of advice.
Well, I like choose a like path that lets you, live your values, serve others, and at the same time you live with purpose. So it's up to you if they're nursing or other, as long as like you are guided accordingly and you're on the right track. Then I think that's the best advice I could give.
And Evan.
I would say explore your options, don't be afraid to switch careers if you need to, or not stick with the first thing you planned on doing. It's okay to switch what you have to do, even if you take a step back. It's better to take 1 year or 2 years changing what you have to do than spend 10 years in a profession you don't like.
All right. And in that case, that is the official end of our career panel. Thank you for your panelists for taking time out of your Wednesday to be here and speak to, I was almost 200 students at one point. I'm just going to do just a little bit of a wrap up, but if you do want to answer any questions that are left in the chat that I might have missed, feel free to respond to them. But I'm just going to do our last STEM Pathways slide. Okay. Hopefully you can see it. So thank you again to all the students who took time out of their own schedule to attend this panel on nursing. If you do want to explore other careers within healthcare, feel free to check out our website, UHN-STEMPathways.ca. We host a lot of both events, both virtually as well as in person. We have different career panels each month, and there's always opportunities to possibly come on site and actually explore these careers in action. But you can find everything on our website, or you can also contact us via email or check out our social media platforms.